Exactly.
So let me ask you this. As a primary care doctor, one of the most common things I'm faced with is I say, hey, you're due for a colonoscopy, and then people never get it done, or you see them again a year. What's the problem in delaying that? And what kind of barriers are you seeing from your end on why people don't want to go through colonoscopy? Is it the prep? What kind of barriers are out there?
Well, I can tell you that patients definitely don't want to do the prep, and when they've done it, they never forget it. I did the prep, and I added some Crystal Light to it, and it ruined Crystal Light forever for me. So.
It's like never again on Crystal Light.
I'll tell you, it's a challenge. Look. I think that primary care doctors play an absolutely critical role in getting patients to come for the colonoscopy, because when they come to see me, they're seeing me for the first time, but they're seeing their primary care doctors repeatedly, and those doctors, the good doctors, and the doctors who are really advocates for colon cancer screening, like you are, for example, really make an effort to take that relationship that they have with their patients and help their patients understand the importance of it. The reality is that patients are scared. Sometimes they just don't want to know. Sometimes they convince themselves that because they're not having any problems, and because they're healthy, that they don't need a colonoscopy. And I think that and there are other patients who have difficulties with access, barriers with access, and there are other factors too, that there may be some cultural factors, because we see patients who have different ethnic backgrounds. But I think that in those patients, what we try to do is make them understand that any form of screening is better than no form of screening. And there are other screening modalities out there, not just colonoscopy.
I like how you say it. Any form of screening is better than no screening at all. And that gets back to the kind of the quintessential issue of prevention. We go into this profession as physicians. We're here to help people. We're here to hopefully make a difference and help people live productive, healthy, and happy lives with their families. And this is where certainly for me, as a primary care doctor, I say, listen, I want you to be seen by me once a year at the minimum for your physical, and at that time we can go through all this kind of stuff. And it's almost like a checklist, but in all honesty, you have to kind of have that checklist. We want to make sure that your body's not breaking out. I don't want my patients to have any surprises. That's just kind of maybe my thing. And so when it comes to colorectal cancer screening, I push it like crazy, and it does get a little bit frustrating at times when I might see somebody back in my office a year later or 6 months later for another issue, and then I kind of say, hey, Mrs. So-and-so or Mr. So-and-so, hey, did you ever go get that colonoscopy? And then they say, oh, well, I didn't have time, or I don't want to do that prep, or I hear stories that colonoscopies are bad for you. And I go, how is that bad for you? So I'm sure you hear all sorts of stories from people coming in, but how do we kind of just break down that barrier even more? I just feel like I want to have people to get these kind of things done. I can't force anybody, but we want to get that done. How do you have that conversation?
Well, the first thing I do is I reassure them that that colonoscopy isn't bad for them, for sure. And patients, you're right, patients bring stories. They bring all kinds of stories. They tell us stories. Well, I heard, my friend had something happen, and they didn't feel well after the procedure. And we now, every periodically, every year, every so often, we reevaluate how we do colonoscopy, and we improve our techniques, and we improve our ability to detect polyps, which are the abnormal growths that we want to remove before they ever become cancer. And I think that it's about education, and we're not going to capture everybody. But I think that the more we educate patients on the importance of colon cancer screening, and I got to tell you, colon cancer is one of the most preventable cancers. Look at the huge drive that there's been over the years for breast cancer screening, and how breast cancer detection and death from breast cancer have been reduced over the years because of aggressive efforts at screening. Well, we can do the same thing with colon cancer. There just needs to be better awareness and more information to the patients.
I like it.